Every moment of every day we leave a digital footprint about ourselves. It captures information about what we're doing. Every time we log onto our phone or our computer, we're monitored by sensors as we move around the world and interact with our environment. And health and social care is no different. So every time a patient contacts with their doctor, there's a record kept, and increasingly those are digital records. But actually we're wearing more health devices, heart rate monitors, GPS trackers that follow us when we go out for a walk or a jog, that are all creating information about health. And health informatics is about bringing those data sources together and using them to understand the health of individual people and populations of people. For researchers, it's opening up exciting new opportunities to understand health and well-being and think about ways of improving health using health data. So health informatics is a fundamental building block, and it's talked about in terms of being a revolution for health science, the next big thing since the genomics revolution. So this course in health informatics is a great foundation for anyone who has an interest in health and social care, in health data, and in doing research using health data. It's a great basis and introduction to health data science. The health informatics course is based over a series of units. There's 7 units in total, and across the units they build up to give you an understanding and an ability to critically think about health informatics. I think you'll get a chance to look at where health data comes from, how you access it, how you assess the quality of the data. What are the issues in terms of the ethics and the legal and governance arrangements around using health data for research and for understanding population health? And then some of the key methodological challenges and skills that you'll need if you're going to work with data in the future. The course is set up as a series of units, and we release them in batches so that there's flexibility for when you do your studying and work with those course materials. But they have a dedicated slot in the calendar timetable, and the reason for doing that is we have an expert tutor who's there to support you during the time frame when that module or that unit is running. But also it allows you to interact with your fellow students. So the course is built around a variety of different teaching materials, but an important part of it is activities where you can develop your ideas, apply the theory that you've learned, and then interact with your fellow students to solve problems. The course covers initially where you get data from, and then there's a block around the governance and how you access and the legal frameworks that we work within when we're working with healthcare data. And then you get onto the methodological aspects, so how to plan your study, how to plan your data requirements, and what you need in order to link different data sets together. We also have a section in the course where you'll work with communicating with data or data visualization. The other key thing that you'll get is, or you'll have the opportunity, is to take a qualification in information governance. That's a short assessment that you'll do as part of your course, and at the end of it you'll have an additional certificate which is transferable across the whole of the UK and fundamental if you're accessing health data for research. So this will give you a set of core skills that you can transfer into health data and health data science, either for research or working within the health and social care sector. But it also are core skills for any data scientist.